Good afternoon, and welcome to today's Social Change Dialogue, Crisis and Opportunity, Building a Better Childcare System. I'm Layli Mapayan, Executive Director of the Wellesley Centers for Women, and I'd like to thank you all for tuning in for today's discussion. Our program will begin with a moderated discussion panel, followed by a Q&A session where we will take questions from the audience. A few housekeeping matters related to this webinar that everyone should be aware of. First, to keep things running smoothly, we will disable the chat. We ask that all of you send your questions using the Q&A feature that you should see at the bottom of your screen. We'll be monitoring the Q&A throughout the program, and that's where you can enter any questions that you have for our panelists. Second, we're recording this program, and the video will be posted on our website for folks who are not able to join us this afternoon. For those of you who are not familiar with the Wellesley Centers for Women, WCW is a research and action institute at Wellesley College. Our mission is to advance gender equality, social justice, and human well-being through high-quality research, theory, and action programs. For 45 years, we've been focusing on shaping a better world for women and girls, families and communities in all their diversity here and around the world. Let me now introduce you to the two panelists who will be sharing their expertise with us today. Unfortunately, one of our presenters, Dr. Autumn Green, is unable to join us. Dr. Kimberly D. Lucas is the Senior Director of Civic Research and Innovation at Metro Lab Network, a collaborative of universities and local governments focused on driving research-informed policy and innovation. Part researcher and part practitioner, Kim has consistently kept 1 foot in the ivory tower and 1 foot on the ground, pairing research and data with practice to seek real solutions to social policy and planning problems. Questioning who we think of as expert and how stakeholders identify value are common threads that pervade their work. Kim's research focuses on the mechanisms that drive both the supply and demand of local early childhood markets, including understanding family childcare provider business needs, as well as tracking changing childcare preferences among families. Prior to their work with Metro Lab, Kim served as the Civic Research Director and then Open Data Manager at the City of Boston. Kim holds an MA in Urban and Environmental Policy and Planning and Child Development from Tufts University and a doctorate in Social Policy and Sociology from Brandeis University. Dr. Wendy Wagner-Robeson is a Senior Research Scientist with the Work, Families, and Children Research Group at the Wellesley Centers for Women and lecturer in Wellesley College's Department of Women's and Gender Studies. Wendy has an extensive research background in child development. Since the beginning of the pandemic, she has worked with early childhood education advocates from across the state to assess the impact of COVID-19 on the childcare and education industry. She has also worked with the City of Boston on projects involving families living through COVID, as well as work with the city's family childcare providers. In late 2020, Kim and Wendy co-authored a report on family stresses and childcare preferences in Boston during the pandemic, which was published by the City of Boston Mayor's Office of Women's Advancement. Currently, Wendy is interviewing parents from across the state to learn how they and their families have coped with work, school, childcare, and the pandemic. Wendy holds a master's degree in early childhood education from the University of Houston and a doctorate in language development from Harvard Graduate School of Education. So let me now describe today's program. Since the COVID-19 pandemic hit the US last year, it has become clear that the US childcare system is broken. The childcare crisis brought on by the pandemic has been a disaster for women's participation in the workforce and by extension for gender equality and the economy as a whole. But our childcare system has long been inadequate when it comes to meeting the needs of working parents. The recently passed $1.9 trillion stimulus bill includes funding to address some immediate and longstanding issues in the childcare industry. It's a huge win for families, and particularly for working parents, and the system of care that makes it possible for them to work. Now, where do we go from here? How do we take advantage of this opportunity to rebuild the system from the ground up? During this presentation, panelists will discuss what the Biden-Harris administration has done so far to support the childcare industry and what still needs to be done, not only to recover economically from COVID-19, but to build a sustainable childcare system in the United States, thereby advancing gender equality. So let's get started. I have a question that I'd like to direct to both of you, Kim and Wendy. Since the start of the pandemic, women have left the workforce in record numbers as they struggle to meet the impossible burden of doing their jobs and caring for their children simultaneously. The pandemic has shown us that childcare is essential to women's participation in the workforce. From your area of expertise, what immediate policies have or should the Biden-Harris administration put in place to address the current child care crisis? And Wendy, let's start with you.
Thank you. So as Laylee has pointed out, and as we all know, the pandemic has clearly shown us that if we want to get the economy back on track, and if we want to get families back on track, we need to treat childcare as a common good and not just as a woman's problem. With respect to childcare, the new administration has targeted $50 billion to help stabilize the system and start rebuilding. And we need to applaud the hard work that advocates have done to continually ask for help to address the crisis. But we need to build from the ground up. We need to make childcare work because come 2025, the money will be gone. In addition, the administration needs to address the crisis of the loss of so many women from the workplace. So many numbers have been given to us of how many women have lost their jobs completely or stepped away or reduced their full-time hours to part-time hours. And the estimates range from 2.5 million to 10 million women. Last spring, in the months of March and April alone, some 3.5 million mothers living with young children left active work, either shifting into paid or unpaid leave, losing their job, or exiting the labor market altogether. Now, since then, some mothers have been able to come back to work. But in 1 year, from January 2020 to January 21, we have found that still 1.6 million women have left, are no longer working. Many mothers have given up and left the workforce. And nearly 750,000 mothers will not ever be returning. They will not be working outside the home and they will not return to work. And those who do this may experience decreased lifetime earnings due to being dropped out of or being forced out of the workforce during the pandemic. So we need to get women back into the workforce and have accessible, affordable, and high quality childcare in order to do so. Thanks.
Thank you, Wendy. Kim, what are your thoughts?
Thank you. And thank you, Laylee. Thank you, Wellesley Center for Women, for having me here. I really appreciate the invitation and the opportunity to discuss these incredibly important matters, and I would call them really urgent too. As you mentioned, Laylee, my area of expertise is really understanding the childcare market in a holistic way. And so I think about the issues that have plagued childcare and the early childhood sector for decades, and now exacerbated by COVID, that can't be addressed with a single policy or a single program. I think about how all of these issues kind of interplay with one another, and really at the end of the day, it's a basket of different things that we're going to need to apply in order for us to really tackle these issues. First, I want to say that the fact that the Biden-Harris administration recognizes the importance of care work as work is a great first step. Right? No other administration has been so explicit about care work. And in fact, the notion of supporting care work was even in their platform as they were running. That had never happened in the history of the United States before. To explicitly call that out, talk about it as work, truly work, I think is something that we need to lift up and talk about more often. And so this framing and understanding, that signals an understanding of how childcare actually ties to much of our lives. And, like I said, a first step, right? In the short term, I want to point to, as Wendy mentioned, the American Rescue Plan Act and how it has covered a lot in terms of both supply and demand. So if you want to think about it like this, what the plan does is it really shores up the current supply of childcare and it infuses much needed cash to families. So on the supply side, we're seeing $24 billion in emergency stabilization funds. On the demand side, we're seeing increases in both the child tax credit and the child independent care tax credit. And it makes both of these tax credits refundable, which is an amazing thing. That means that everyone can receive them regardless of whether you owe money in taxes or not. And now you can be advanced over that money over the course of the year as opposed to one lump sum, which, like, both of those things, I think we should lift up and really understand how impactful those changes are to those tax credits, noting that this is only for this year, right? And so thinking about how short-term this is, what we really want to do is think about how we sustain these incredible advancements, I would say, over the long term, not just the immediate term. And then finally, I also want to lift up the fact that in the American Rescue Plan, there is both supply and demand support in the $15 billion toward the Child Care and Development Block Grant, which subsidizes child care through block grants awarded to states. And like I mentioned, this is a great start in addressing the immediate need, but we really need to think about how we build the momentum towards, using these pathways to addressing these long-term issues. These issues have been here since before COVID, and so we have to think about how do we sustain these things.
Thank you. And, I'm hoping that we can think about some of these one-year policies as sort of a pilot project for possibly bigger policy innovations later. I know it's going to be really important for researchers and policymakers alike to weigh in on the effects and, to really gauge if things are working as we had hoped that they would. But you're right. These are some huge innovations that we haven't seen in past administration. So let's tune into the current moment with this question. It's been about 1 year since childcare programs across the country closed down due to the pandemic, and many of them haven't yet reopened. Yet we know that the economy can't get back on track without childcare, as you've also ably pointed out. What would you like to see the Biden-Harris administration do to support early care and educators and help them reopen safely? Kim, how about you go first on this one?
Sure thing. Just in addition to thinking about the stabilization and CCDBG funds, I think in the immediate term, when we think about reopening and getting folks back to a place where they feel safe and comfortable, and by folks, I mean everybody, right? I mean families, I mean young children, I mean early educators, I mean center directors, right? And all of the supports around in early childhood, in order to get everyone back into a safe place where they feel supported and secure to move forward. I think that foremost, what we're going to need are clear, equitable, and standard guidance regarding health and safety protocols. We saw this as a need when it came down to COVID testing, and many childcare programs across the United States were open or kind of had to be open just to sustain themselves. And we're seeing the need here with vaccines as well, right? We're seeing the need for a better understanding around vaccine awareness and distribution. We're seeing the need for coordination with the K-12 system and out of school time programs, right? The directives around how do we do that? What are the logistics around this? Who should reach out to who even, right? And what are some of the things that we should all keep in mind? Is it 6 feet? Is it 3 feet? What does that mean for young children versus elementary age children? And what do all of these have in terms of ramifications for early educators and teachers in the classroom? So thinking about these things holistically and how these systems are interconnected are really important. Just to add to that, travel protocols, right? Different states will have different travel protocols that open up in different ways. how do we deal with that? And what does that mean for, the young child who has been crossed over state lines for a couple of days and now is coming back to childcare? What does that mean for the early educator? What does that mean for other families who are in that childcare? And all of that directive needs to be clear, consistent, and really relayed to children, families, providers, but also all of the people who touch young children's lives, right? We need to have this message be something that is heard by everyone so that we can support our families with young children. So pediatricians, folks working with young children in early intervention, right? Those folks need to hear this same exact message as well. We should also think about, what are the needs for hearing this message? So thinking about making it as simple enough to understand at, let's say, an 8th grade reading level, right? Understanding how to translate these messages into multiple languages, because we know our families may not speak English as their first language. And just really thinking about that strong encouragement to use those existing local networks to spread the word, because word of mouth is your best bet in terms of reaching everyone. And that's what we need in order to maintain this consistent message. So at a time when we all know that new knowledge can change, there also just needs to be a singular source of truth, right? Like, where's the one place where we can easily identify changes in protocol, new things that we've learned, and new directives that we have or suggestions that we're making for this entire community.
And I think your comments really highlight the value add of having childcare researchers specifically weigh in on the safety protocols and help to create the directives, because while the doctors and medical researchers can point out the medical facts of what needs to happen to prevent the spread of the virus, it's the childcare researchers and the people who work in that field who are going to know how kids behave, how teachers behave, what the routines are, and where the best points of intervention are. So I like how you really illuminated that. Wendy, I know you also have some thoughts about this.
Right.
Please.
I also think, besides relying on people like Kim and myself, researchers, we also need to talk to the actual educators, because they know the children the best. They know what they need. They know what the children need. And they're the ones that really need to be listened to. We need to collaborate with the people on the ground so that we get them what they need, and we listen to them. We really listen to them if we want things to get better. Also, it needs to be pointed out that in Massachusetts alone, the childcare workforce has really been hurt. Only 70% of the providers that were there last year are there today. And more than 8,500 childcare providers and educators have lost their jobs just in Massachusetts. And one more point is that the poverty rate for those in early care, those educators, is about 8.7%. It is extremely high. We need to address, when we're talking about stability for educators, we need to address the low pay that we find early care providers receive. And we need to increase that pay if we want to keep them in the field.
Mm-hmm. That's always a worthwhile point. And, figuring out how to do that is part of the strategy that we need to develop. Let's pull the lens out farther again. And I think this might even be a bridge to your last point, Wendy. The pandemic has caused a lot of new problems for the childcare industry, but it has also shown a light on a number of problems that have been here all along. For instance, low-income families often face unaffordable or inaccessible childcare options. What role should the government play in ensuring that childcare is available, high quality, and accessible to all families? Wendy, this is made for you.
Okay, so this is a little radical, but as we all agree, the government does need to play a critical role. And I think there should be national standards regarding childcare. So I think there should be free, universal pre-K for all families that want it, and a system that leads no family to pay more than 7% of their income on childcare. I think Head Start should be available to all eligible families, and that no family should be left on a waiting list, hoping that one day they'll get the call that there's care available for their child. I also think that families should be allowed to access the care that they want, whether it be a center, a family childcare home, or kith and kin care. So I know it's large and it's dramatic, but this is what I want.
Well, it's nice to have all of those recommendations in one place. Any key thoughts that you have about how to get from where we are now to those outcomes that you just described?
I think the new administration is listening to people that are advocating for things like this. And I think, because some of these programs are only 1 year, they've got to decide what happens after this 1 year. What happens when families go back to poverty? What happens when families cannot build up like they wanted them to? They're going to do as much as they can in the course of 1 year, but then we need to continue the growth and the trajectory that we're on, so that no families are in poverty, no families are left behind, and no children are left behind.
Thank you. Kim, I thought I saw you start to say something. Did you also want to weigh in on this question?
Yeah, I mean, I just think that there are a lot of pieces to really fit together, right? And I think that Wendy said it best, let's start by listening to where folks are hurting the most, where folks have needs the most. But how do you operationalize that, right? I think that that's the real big question, is what does that look like? Really, at the end of the day, the federal government currently provides primarily funding support and the program of Head Start. And that's the role that it plays when it comes to childcare. When Wendy talked about thinking through childcare as a universal public good, right? We're really thinking about really the states and local governments as the primary implementers of that public good. And so I think part of this is really looking toward how might we support those states and those local governments in doing this rollout, if we could possibly get there and reach Wendy's dream and ideal, right? This utopia, at the end of the day, it is going to take actual support for those folks who are on the ground. And I think that that's incredibly appropriate because, to Wendy's point, childcare is local, right? As someone who has not tried to find childcare myself, but who has worked with a lot of folks in the field and a lot of families, many families will say, well, I'm either going to try to find childcare practically near my home or near my work. And that's incredibly local. So when we think about how this rolls out, we really do need to think about how does this interplay between what the federal government can do really support the work on the ground that local and state governments are going to have to do.
Well, that makes complete sense. Here's a question that does actually speak to the issue of collaboration. Over the last year, we've seen early childhood educators and K-12 educators take a wide range of approaches, including fully reopening in person and adopting hybrid models to reach children and youth during the pandemic. Is there an opportunity for early childhood educators and K-12 education systems to work together as they respond to the pandemic? Wendy?
Well, first I need to say that as the New York Times has recently pointed out, while schools were closed because of unsafe building, unvaccinated teachers, and so they either went through no schools were open, or there was a hybrid method or remote method, childcare has been open ever since. Childcare was sometimes even done in the same buildings as the school classrooms were going to be there. They were not appropriate for children of K through 12, but yet that they were appropriate for young children and the teachers that cared for them. But not saying that much, I do need to say that there needs to be collaboration between early childhood education and K through 12, starting with making sure that all programs in all school buildings and all buildings period are safe for both children and the educators, no matter how old the child is or how old the teacher is, or who the teacher is, I would say. In addition, educators serving children 0 to 5 should receive the same pay as those serving children age 5 to 21 in school districts across the nation. And there has been work in many communities looking at the birth to grade 3 or grade 5 continuum and learning the best ways to form partnerships between community educators and the school district. We should always think it's 0 onward, not break it up between 0 and 5 onward.
You know, I'm thinking about the question actually in terms of just some things I've seen within the last week about the Biden-Harris administration's plans to potentially fully expand pre-K for 3 and 4-year-olds. And that's going to create an interesting overlap between the current childcare industry that focuses on 0 through 5 and the K through 12 school system. Do either of you have commentary about that possibility? Jump in. Yeah, anybody.
Well, I would say we cannot forget the infants, the babies and the toddlers, because those babies and toddlers become 3 and 4-year-olds in just a short period of time. And we can't forget the teachers who provide care for those children either. So I know the push is on pre-K education for 3 and 4-year-olds, but don't forget the other ones.
Mm-hmm. What do you think, Kim?
Yeah. I was going to weigh in and say, you know, I think we can take a lesson from Washington, D.C. in their rollout of universal pre-K in really understanding how initially they focused on 3 and 4-year-olds and what that did to the local childcare market, right? So if we really think about how localized these markets are, when you have a focus on a certain age range, it really does have a ripple effect both ways. And so understanding how Washington, D.C. rolled out, weathered that storm, and maybe asking them what they would do differently the next time, or if they had a second chance, I think we can all take lessons from that. One of the things that strikes me in that story from the DC rollout of universal pre-K is that we have to understand that everything happens in kind of a chronological order, right? So like starting with, I would say prenatally, all the way into, baby toddlerhood, and then into pre-K, and then into the public school system. This is one person rolling through that. What we know from the child development research, and this is, tried and true, is that transitions are really hard for young children, and they're hard for families too. And so when we minimize transition and create a seamless system across all of those things, it's not only better for young children, it's better for families. We create stable and very stable and predictable, there we go, that's the word, systems that families can follow along through. We know that from COVID, that unpredictability and instability is something that is very hard on us, all of us. And so creating this seamless system, thinking about what's the pathway that a family goes through when you have a very young child all the way into the school system, and how do we connect those so that they're aligned and seamless, and so that, overlaying 3 and 4-year-olds and thinking about universal pre-K in that way doesn't create too much of a ripple both ways. I think that's the piece that we really should think about as we create this system.
Mm-hmm. All right, well, here's a question that goes in a slightly different direction. One of the things we've learned from the pandemic is that childcare is directly tied to our economy, which is not always part of the conversation when we talk about childcare. So when we think about building a stronger childcare system in this country, are there other policy areas that advocates and lawmakers should be making connections to? And Kim, let's start with you.
Yes, I think unlike the different things we study in academia, or maybe even the ways we address the world through government, real life doesn't happen in silos. Right? Real life is an integrated version of all of these different things. Childcare, we now know, hopefully we all now know, is an essential part of real life. And, I think the pandemic has highlighted just how tied it is to all of the other sectors. So I'll give you the example. Childcare, we now know, is a bedrock to economic development. right? We've seen that families without childcare find it incredibly difficult to balance work and care. And we've seen that as small businesses themselves, childcare centers and family childcare providers have been left out of some key small business initiatives. We don't think of family childcare providers or childcare centers as being businesses, but they are. And without having targeted business opportunities, programs, initiatives specific to that sector, uplifting that sector, we see how rocky it can get when shocks like a pandemic might happen. The other piece that I'll lift up, or I'll lift up two more examples, like childcare as a labor and workforce development issue. This is a sector that's dominated by women. It's largely Black and brown women and immigrant women. And low wages in this sector point to the need for attention from places like the Women's Bureau, the Department of Labor, right? Thinking about what can we do to lessen that wage gap, because it's not just big. Like, we know that the wage gap between women and men is big, but in this sector, which is a low wage sector, it's huge. So how do we address this wage gap from the lens that this is actually incredibly valuable work? What we're doing is entrusting our most precious, right, our young children in the care of the folks doing this work. And they are specialized. They have amazing expertise and knowledge. I myself cannot fathom how to keep, 2 toddlers entertained and learning, right? And supporting their growth and development, let alone 10. Right? And this is the work that they're doing. It's incredibly specialized. It's chock full of skills, and we don't value it enough. So thinking about how this is a labor and workforce development issue. And I'll just toss out one more wild example. This is a housing issue. Childcare is housing. We know that childcare markets are local. I've said that a number of times, all the way down to neighborhood. When housing prices become unaffordable, right? And when early educators must move out of their own neighborhood due to skyrocketing rent, childcare becomes a housing issue. Why should an early educator commute back to her neighborhood in order to do that work instead of, when she's relocated, setting up shop there, finding a spot there? Well, now that old neighborhood is without another early educator, and that's a disservice to all of the neighbors and young children who could have been served by that person. And so thinking about this as a housing issue is really important. Wendy's mentioned how important this is in connection to K-12. And so I won't go through that, but this is not an exhaustive list. Once you look under the hood, and this is something I tell my students when I'm teaching at UMass Boston, I have an early childhood policy class. Once you look under the hood, childcare policy is not limited to children or families or early educators. This is all of us. Childcare policy is everyone's policy, and it behooves all of us to really start thinking about childcare policy that way.
Yeah, I appreciate you making those connections explicit, because those are the kinds of things that people really need to think about with great intentionality. Now I'd like to turn a little bit to your research, Wendy and Kim. Through your research, you've both had the opportunity to speak directly with parents and guardians in the Boston area about their childcare needs during the pandemic. How can your findings inform childcare policy decisions? And Wendy, please start us off.
So as much as we know about childcare demand, and you can read it in the literature and such, we really have no idea what families want or need, and the various constraints they're under and they face when they decide on what childcare they'll use, unless we take the time to talk and really listen to what families say. So the work that Kim and I did this past summer with parents and guardians throughout Boston over the summer, we heard that families were most interested in small group sizes, location close to their homes, flexible hours, flexibility and understanding regarding drop-off and pickup times, true affordability. equity in the distribution of high quality childcare, educators who are professionals and who are valued as professionals, and a balance between education and care, and as well as some other organizational amenities. And families' preferences have changed during the pandemic. And we notice there isn't a childcare option that meets most of these family preferences. And childcare providers are going to have to shift their business models. But before they can, other stakeholders in the field will need to shift the system. If we really want to provide the types of childcare families want, we will need to create the proper infrastructure for that type of childcare to exist and to thrive.
Thank you. Kim, what have you discovered in your research?
I'll just tack on that when Wendy and I were doing this research, it just strikes me that in relation to where we are now, right now we're still in the midst of a pandemic. And while we're hopefully heading into a transition period toward life that is a little less, maybe a lot less physically distanced, we're still in that transition period. And, I've mentioned this before, but transitions are hard. And that's not just for young children. It's not just for their families. It's for any human. And so part of the reason why they're hard is because the unknown is scary. We don't actually know what's going to happen on the other end, and we all need to feel safe. When we see that childcare preferences have changed because of the pandemic, what we also simultaneously know is that they're going to change again. They're going to continue to change as we transition. And, one of the biggest things that we heard from families was that they were scared about all types of unknowns. Everything from, will I get COVID? Will I bring COVID home to my family? If I put my child back in childcare, will they bring it back to my family? Or will I lose my job? All of these things that they were scared about. And as we transition, it's going to be even more imperative to keep a pulse on how families feel. Right? What we're seeing now, even as we're opening up in Massachusetts, we've begun to start opening up, and we're trying to see our families coming back, and it's a slow start. You would think, oh, childcare's open, let's go. You don't see that across the board. And so paying attention to how families feel, addressing the needs and concerns that they have, and oftentimes, going back to our research, I'm going to say that it's because they're scared of something or a lot of things. With every decision that a policymaker makes, they're going to need to ask themselves, if we do this, how are families going to feel? Are they going to feel safe? How will early educators feel? Will they feel safe? There's a lot of stakeholders here, and it's important to consider how they will feel when these policy changes roll out. What else do we need to put in place if we're going to do this? What else do we need to put in place to make sure everyone feels good about this? And paying attention to that feeling is not an easy task. I'm not proposing something that's easy, but I think it's incredibly important.
Yeah, thank you. Your comments are making me think of another question, and that is that both of you have done research both before the pandemic and during the pandemic. You've done research with families, you've done research with providers, you've done work with policymakers and local governments. And for all of us, this has been a learning experience. What are some of the things that you think families have learned, providers have learned, policymakers and governments have learned as a before and after with the pandemic that can help us, build a better childcare system moving forward that may have some very different features?
I think one thing that many families have learned is that especially moms, that working from home and taking care of young children really doesn't mix well at all. So many mothers that we spoke to, and fathers too, who were able to work from home, realize that first of all, screen time increased incredibly. Is so much, you're not supposed to have any screen time for kids, and a lot of families decide to use that. But even if they were trying to help their school-age children with their schoolwork, they couldn't just leave them alone. Just like you can't leave a young child with the computer, you can't leave a school-age child with a computer sometimes as well. And mothers especially realized they could not do the work that they had to do while they were caring for their children.
Mhm.
You can't feed a child a snack or wipe a bottom or a runny nose when you're trying to type out an email about some proposal that someone has given you, or give a really great answer to a phone message.
Mhm.
So what we found is that so many of our parents had to make up the time to do their work in place of doing anything for themselves. So instead of sleep, they worked. They worked late at night. They worked after the kids went to bed. They worked before the kids got up in the morning. They lost out on a lot of self-care for themselves because they were either working or they were taking care of their kids. And so many moms and dads that I've spoken to can't believe that they even made it through March and April and May of last year. They don't even know how they came out of it, because when they look back, they can't believe what they had to go through in order to do what happened. And then you also said, and Kim, you pop in too. I know you said government policymakers.
Oh yeah, I said families, providers, governments, and policymakers, and I guess I can throw in employers based on your comments, Wendy.
Well, I also want to say that providers, they lost their incomes when the pandemic hit. They were closed. They could not go back. And then they were just as afraid of the unknown. How do they know if what they do, these cleaning things with gloves, masks, what do I do? And how is this going to really protect me from the other families that are going to come to my center or my family childcare home, from other people? How do I keep everyone safe? And the stress, I think, was incredible on not just that we know that's stressful on the families, but also extremely stressful on the educators. It was very, very difficult, especially those who provided emergency care. So very often they're children they never knew before, parents they did not know before, but they opened up their homes or their programs to provide care for essential workers. And they didn't know these families beforehand very often.
Mm-hmm.
Kim, I'm going to let you weigh in too.
Thanks, Wendy. It strikes me that one thing I think we all feel, right, and now, like, what we all know now is that this is the childcare system, I'm putting that in air quotes, is not a system. It's been cobbled together, piecemealed, and really works on the backs of a lot of women who are doing this work that is incredibly physical, incredibly emotional, and incredibly skilled labor. And so what I hope, if I can be so bold as to hope what we're all learning from that. So I think we all feel that, but what I hope we're all learning from that is just how long we have let this field go undervalued. Just how long we have actually been building our businesses and our economies, our labor forces on top of the backs of women, primarily women, doing this work for us. And that's the issue of, down to families feeling strapped for time, down to employers feeling like their productivity may be falling or worrying that they're losing their workforce, out to cities wondering if they can actually retain and build up and sustain an economy out of the pandemic. And so I think that this is, that's my hope, is that our takeaway is really, if we're going to shore this sector up, that we really need to rethink how we've been doing things. We really need to shift the paradigm in terms of how we've considered this type of work. And we really need to understand and truly value the kind of work that this is.
All right, so I have a follow-up question, and I'm going to put a little bit of an extra spin on it. According to the Labor Department, 93% of childcare workers are women, and 45% are Black, Asian, or Latino. Before the pandemic, this workforce faced low wages and lack of benefits like paid time off. How can the Biden-Harris administration improve conditions for workers in this industry who are primarily women and women of color? And after you answer that question, I'm going to give an extra question on that. So let's start there. Kim, why don't you go first?
Sure. I think the majority of childcare businesses are small businesses. We know that childcare businesses operate on very thin or even negative sometimes margins. And many of the women of color who run their own childcares operate as either family providers out of their own homes, or they're often sometimes, center-based owners. And at the end of the day, thinking about, you mentioned, Layli, the idea that, many of these places are without benefits. And in my past research, the number of people who got their health care from their partners, and we live in Massachusetts, we have to have health care here. And so you're getting your health care from your partner. Imagine if you don't have a partner to get your health care from, and how hard it is to navigate that system, even though we do have that system. When you extend that nationwide to other states that don't have a system to navigate, how expensive and how hard it is to find just health care, right? Thinking about that, having health care that's provided and not tied to your place of employment is maybe one of the biggest things that we can do for these people, for these women who are doing this work. And this is, certainly for the Black and brown women, the immigrant women who are doing this work, but also for just everybody doing this work, right? Being able for them to understand that they don't have to choose between going to the doctor and working that day, knowing that they can pay their healthcare bills. I think that's a huge thing. Another piece is really thinking through, what's a retirement plan? What's something how might they save for their future? So that I've interviewed people who are nearly 70 years old, over 70 years old, still doing this work. And because there is no retirement plan, how do we help support these folks in terms of just basic benefits that I think every person, and especially people doing this kind of essential work, just needs, because they're doing this work and it's essential and important labor for not just those young children and just those families, but for really all of us.
What would you like to add to that, Wendy?
I really think that we need to do something about the pay that these women, mostly women, receive, because so often women who are in this profession work more than one job to get by. So think about caring for 20 preschoolers or 10 toddlers all day long. I would fall into bed. But no, I've got to get up and I've got to go to my second job because I'm a waitress down the street and I'm going to be there till midnight. And then I've got to get up at 6 again to get to my center or get my home ready to have children come in. So if we think it's really hard for us, think about how hard it is for people who are doing it day after day, 2 jobs, 3 jobs, any job they can find. And, they don't have time to even take care of their own educational needs or be able to do everything that they want for their families either, because they are constantly working. So I think its pay really needs to be addressed. If we cannot have childcare providers who are doing the essential work, caring for our greatest treasures and living in poverty, we cannot have this go on any further.
Right. Well, I love both of your answers. And so the add-on that I want to put on this question, just to get our thinking caps or our imagination really going, is, seeing how intersectionally rich with diversity the childcare arena is, how can the childcare system, the childcare centers and the actors in childcare help us become engines of racial and gender equality in our society. You know, I think there's room to think about that. What might you say about that topic? Kim, why don't you jump in?
I will say, you know, the people that I've worked with in this sector who are on the ground and doing the work know a ton, know more than I do, for sure, about how this system works. Imagine if we had these folks in seats of power. Imagine what we would know about language needs, about cultural competency, about class diversity. Imagine what we could tap into if we only literally just handed over some power. And so I wait for the day that actual early educators are invited to sit on boards, where actual early educators or families with young children, you know, are given the opportunity not just to be some advisory group somewhere, but actually wield power, be it on a local level, on a state level. I might even venture on the federal level if we could figure out how to do that, right? Giving folks who've had this experience literal power to be able to make real decisions that affect people who are just like them. I think that that's what we do in order for them to really share their stories, share their expertise, put it out on the table, and really illuminate, I think, the rest of us as to what really goes on the ground. I think that's where the real solutions come from. And when we think about intersectionality, there is no one better than the people who do that work day in and day out, who work those multiple jobs, who, you know, speak multiple languages and have to navigate the systems we've made for them. And there's no better way to address the concerns that they have than to move over, get out of the way, and let them sit at those tables or create their own tables that we come to and that we listen to, because they actually get to call the shots.
Mm-hmm. That's a great reflection. Wendy, what would you add to that?
Well, I applaud Kim and her answer, because we do need to listen to people, but not just listen to people, but put what they say into actual policy. So find out what they come up with, you know, listen to their solutions. And if they, and try to put those solutions to really into work. We ask families, can you find childcare?
Mm-hmm.
And they say, I can't afford childcare. Well, what can we do to make it so that you can get childcare? Because so many families say, I looked at the childcare down the street and there was no way I could afford it. Or the childcare across the neighborhood, it was so incredible. They did such wonderful things with the kids. And then I found out how expensive it was, and I was priced out of it. So we need to find out from families what they think could be done to help solve some of these problems that they are facing daily. And also the family childcare providers and center-based providers. What do they need so that their lives are better? Because if their lives are better, our children's lives will be better.
Mm-hmm. Thank you. And, you know, I also just want to point out, Wendy, what a huge engine of social change, particularly for gender equality, the NICHD study of early childcare was that you worked on in the past, because before that, you know, a lot of women were wondering whether it was even safe to leave their kids in daycare. And because of that research, which the federal government invested in, and which numerous researchers, including our team at Wellesley Centers for Women, were able to participate in, we were able to decisively answer that question, so that there are women alive today working who can't even remember a time when people worried about that, because that work was done. So I just want to talk about how powerful that was in terms of making social change in the direction of gender equality. And that's a lead into my final question. And so for those of you in the audience who may have questions, now's the time to start putting them in the Q&A box. But my last question is, from our conversation today, it's very clear that the pandemic has intensified the childcare crisis in our country. And we believe that research plays an important role in informing decision makers so that they can enact effective policies and practices, both in COVID times and outside COVID times. How would you like to see this administration use data and research to inform its child care policy decisions?
Well, I can give one example that's happening right now, and that is in the city of Boston, the first of the nation to ever ask its residents what they were doing about childcare and what they thought about childcare through their yearly census. So it was done in 2019, the first year. 2020 was a little bit, we couldn't really do it because it was a big census year and all. So going back in this 2021, we're doing it again. And instead of a third of a page, because we only had so much space last time, we now have a full page to ask families about childcare and ask about how much it costs and what they're looking for and what they want. And this is really remarkable to do something like this. It has led the city of Boston to realize that it needed to beef up its family childcare systems and homes rather. And they started a program where they're through training, family childcare providers learn about what a business it is to have a family childcare home, what things they can use for marketing or for tax purposes, or what they can do to understand the business of their program, and also get a little funding to help with either beefing up their facilities or maybe taking out an ad or having someone do their taxes. And it's been so far a pretty remarkable program, and it's continuing on from even this year and next year. And the census data that we're going to be collecting will be able to input and grow programs like the family childcare program. And, you know, I was lucky, and Kim and I both worked on the questions for this year, but the last census, I was lucky enough to help with that data. And families, even though it was a third of a page, they wrote what their problems they were facing with childcare. So they would say, I cannot afford childcare. I'm going to have to leave the city of Boston because I cannot afford any kind of childcare. Or I really want to work, but I just had twins. I can't find childcare that I can afford. Or I speak a language that I cannot find in any of the programs that I have looked at. I need a program that meets the needs of my family and my children. So these are things that they're so important. And we take what families say, and the city of Boston, at least, has listened to families and is trying to do something about childcare. But we're expecting to have even more responses for 2021. I think I'm going to be just like, it's going to be huge. And I think it's going to be very, very helpful for the city to come for next year and the years to come.
Mm-hmm.
So.
Well, hopefully with our mayor's movement to Washington, D.C., he can spread some of our methodology throughout the rest of the government. Kim, what do you think? What are your thoughts about research and data and how the new administration can best use it?
I have many thoughts. So, you know, I've alluded to this before, but like just thinking about, you know, on the federal level, one of the biggest things they do is just provide funding, and thinking about how actual implementation happens, it is on the state and local levels. And, you know, I can say that when I was trying to formulate my dissertation project, it was actually really hard for me to do something statewide, locally, using the data that we have, because while we have amazing national data sets that the federal government has in a lot of ways backed, and we have, you know, great data sets to really think about the national picture, right? It varies state by state. Some states have amazing data sets, other states don't. And when it comes down to the more granular local data sets, and like I mentioned, childcare markets are local markets. So you can't take a statewide data set and say, that's how it goes in Boston, because actually that's not how it goes in Boston. You know, that may be how it goes in one neighborhood in Boston, but not this neighborhood right next door. And so when we think about the really good granular data, meaning consistent and valid data that can be connected with other data across states, and if we're dreaming big across cities, we really need to invest in that data infrastructure. So before the federal government can even use that data, we have to source it up. And so we have to make sure that that gets sourced up in the right way. I think the federal government can support this in two ways. So first, the federal government is great at providing funds to do things, delineating funds not just for child care, not just for subsidy, and not just for quality, but actually delineating funds to build real, robust, useful, and aligned data systems that can actually produce that and capture that granular data, I think is really important. And if we want those data systems to be aligned, it is the role of the federal government to make sure that happens, because piecemeal state by state, that's going to be really tough to move toward creating alignment across data systems. Also, just to point out, those data systems need to be secure, because if we're capturing data about people, that's really important. I know the federal government, through the American Rescue Plan, has already thought through those things for itself. And so I'm confident that moving forward, hopefully they would also apply this to other data pieces. The second thing, and this comes from my current job at MetroLab, is that I think the federal government can actually spark and inspire new forms of research and collaboration. This is going to yield different types of data, right? I'll just point to a project that I'm currently working on with my colleagues right now that the National Science Foundation is currently pushing forward, called the Civic Innovation Challenge. And that challenge really highlights the fact that we want to see community identified, community-led problems and issues that folks want to work on the ground at the local level, supported by academic research and data. And so, one of the things the federal government could do, and specifically the Administration for Children and Families, could be to look to this type of model for funding research and say, let's adopt that, let's apply that. What does that look like when we think about sparking new and different types of research, sourcing up new and different types of data in this field? And so, the ACF does a really great job of sparking Head Start research, a lot of quality research. Could they consider adding on a new track that really considers, what are the real issues on the ground? How do we start with those issues and then bring in the civic researchers, the civic data scientists, the civic designers to help support those local issues that are, I think, twofold, both intellectual merit, but also incredible on the ground impact.
Thank you. Those are great comments. I like the emphasis on getting more and better local data, on data coordination, innovation, data security. Those are all really important points. So we've reached the point now where I'm ready to start offering some audience questions. We've got 3 in so far, so I'm just going to shoot them to you. The first one says, I live in Maine. Can you comment on any differences in issues that need to be considered when thinking of childcare and rural areas of our nation? I think that's a great question. What do you guys think? Who has an answer for that one? Wendy, you look like you're ready.
Well, I know that the Study of Early Childcare and other studies that we've done at Wellesley, WCW, we have looked at care in both rural areas and urban areas. We do know that just as there are childcare deserts, meaning no childcare available in certain sections of in cities, it's also very, very easily to find in rural areas where you may have to travel if you want to go to a childcare center 50 miles or more. And that's really not something feasible for a family to do, especially if you have a crying or whining infant or toddler in the back seat. There's no way you're going to be able to do this day after day, driving that much. But there's also a shortage of family childcare homes, although we find more childcare homes in rural areas than we do in centers programs, just because of the geography. So yeah, it's definitely a problem. And I know I spoke with people across Massachusetts, in all the areas of Massachusetts, not just the Boston area, and they're telling me where they had to go, what city or town across, a great distance in order to find the childcare they needed, because they wanted to find high quality childcare, but and maybe the home across the street or the center across the street was available, but it was not of the quality that they would put their child in. So it's a very big problem.
Interesting. Kim, do you have anything to add on that one?
Yeah, I mean, I think, one of the things that we know around workforce development, like early childhood workforce development, is that early educators thrive in cohorts. And, in urban areas, one thing that is just a challenge is that with family child care educators in particular, because they're living and working in their home, right? They're not commuting over to a center. They're not seeing other early educators usually as coworkers. And so it's really hard to battle that isolation that they feel. And that's in an urban area where you could have, some places in Boston have, 2 or 3 family child cares on the street. And so imagine that in a rural area and extend that beyond family child care to centers as well, right? We're really battling isolation in terms of having folks to just talk to about what's your best practice. How do you get through this? And that's not just about quality and best practice in the classroom and working with young children, but it's also about mental health and well-being and understanding, how did you get through this 10-hour day? How do you balance work life with your family, right? And so thinking about how we create those cohorts when physical distance actually exists, and maybe COVID has actually helped highlight some ways we can do that, is something that I think folks in rural areas do have to pay attention to much more, or in a greater way than we might need to in urban areas.
Yeah, great points. And I was just thinking, like you were, that maybe, all this experience we have now with all these digital convenings would be something that could help that problem. All right, so the next question is, something was said earlier regarding parents, overwhelmingly women, who have spent time out of the workforce due to childcare. This does have repercussions in terms of reentry after long or short periods and lifetime participation in the workforce, and then into well-being in later years, retirement, or working well after retirement age. What are your thoughts on the economic well-being of women who have spent time out of the paid workforce, voluntarily or involuntarily, and their place in the overall environment of childcare?
Well, we know that moms have either been stepped out of the workforce or been pushed out of the workforce due to the pandemic, and we want those moms to come back. But we also know that both moms and dads and other family members need to have mental health resources that they all need, because this was such a trying time for so many people. Kim and I know from our work this summer, there were so many parents that were just so overwhelmed and at the breaking point because they just couldn't take it any longer. So I think, we want people back in the workforce, but I think that mental health concerns need to be addressed nationwide first, because it's so important. And we do know that stepping away from the workforce is detrimental in terms of retirement and potential earnings and things like that. But we got to take care of ourselves first before we put money in our pocketbooks.
Tim, any additional thoughts?
I mean, I think this is a tough question. I think it's a really tough question because, the person asking is definitely referring to both folks who step away voluntarily and involuntarily. I think the hard part around this is really focusing on the involuntary folks, right? Like who don't want to step away from the workforce. And what does that mean for their careers? Short-term and long-term. I think this is one place where when we look to employers, and particularly large-scale employers that have the ability to do this, we have to really ask and think about, what are the systems in place that, hold the line for folks, right? How can we ensure that folks aren't losing ground? And when people are involuntarily stepping away, what does that mean? And I look to the literature and understanding of how much time and effort it takes to train someone and onboard someone. It's a lot of expense for an employer to bring a new person on. So when we think about workforce retention, we want to think about anybody who's stepping away from the workforce, right? One of the things that I found really interesting during my time at Brandeis was our department, the sociology department, created a tenure track position that was part-time, so that if you had young children, and from an academic standpoint, and for those of you who are not academics, having children is a thing where a lot of folks time that to coincide with different aspects of tenure, because it is such a laborious time trying to achieve tenure. And so having a part-time tenure track position, crafting that is an incredibly mindful thing for the department to do, to say, actually, if you happen to have young children, we're not going to deny you tenure, and we're going to allow for you, for your work-life balance. And guess what? Yes, that tenure track position was made for a woman stepped into that position, but could a man have stepped into that position and been able to care for his children as well? Yes, absolutely, right? So these are the kinds of things that when we look to employers, when we look to workplaces, getting creative about how we retain and keep good workforce. I think that's the bottom line there. You don't want to have those transactional costs, those transition costs, when you have to offboard, onboard, and at the same time, when you provide these kinds of innovative solutions, it's a win-win. And so you get to keep and retain talent, and a person gets to keep and retain their job at a salary level that's appropriate and gets to participate in the workforce as they want.
And also, I think employers also have to do more too. They're going to see that they have lost their part of their workforce. So many women have left, or women who they're left voluntarily or involuntarily. I think employers are going to have to rethink how they treat, what they do with their workers, what benefits they provide. Do they offer flexibility? Do they offer varying hours of work? They're going to have to, I think businesses are also going to have to revamp the way that they treat their employees.
All right, we've had several questions come in since you were talking, so we're going to have to somewhat speed through them to get to everyone. So if you don't mind answering these next set of questions succinctly, we have right now 4 in total. One is, you've highlighted a very important issue, the need to recognize care work as work. It's often not taken for granted and the skills are not recognized. How can we change that? So briefly, how can we change people recognizing care work as work? Wendy, what about you?
Or Kim, you can say something too.
And you're about to jump in. Okay. Either one.
Yeah, no, I was going to say, I think this is one of those things where if we don't talk about it, it doesn't get talked about, right? And so that's the thing, is we all need to just talk about it. That happens so many times with issues that are considered women's issues, right? Like we don't say what it is. We don't call it out explicitly. We don't say that actually this work is real work. It takes, soul and heart and actual physical strength. It takes a certain skill set, right? Let's talk about that. And I think, it's not that we don't know it. The number of families that I've talked to who will say, oh my goodness, my childcare provider saved my life. I don't know how she does it. She's amazing, right? She's not just doing the work of caring for children. She's caring for that family, and she's caring for multiple families all at the same time. Let's say it. Let's honor that. Let's recognize it. Let's uplift it, right? And on the small level, tell your childcare provider how much you love them. And on the larger level, if you've got a platform of power, tell everybody else. And I think and how childcare has touched your life. This is what we have to do. It's a culture change, and it's a hard thing to turn around, but the more we talk about it, the more we change.
Okay, yeah. Wendy, briefly, you want to weigh in? Go ahead.
Talk, write op-eds, get the word out, definitely.
Okay, next question. let's see, combining two questions into one. We hear a lot about the great early childhood education systems that exist in Canada or Europe. Are childcare workers paid and treated well in these other parts of the world? Are these models we should emulate? What can we learn from what they've done right and wrong? So this is the global question.
So we often think about childcare in the Scandinavian countries or in France and how it's so wonderful and everything. But you have to remember that taxes go to pay for this service, and Americans don't want to pay taxes. That's what it comes down to. If you want these services, if you want great healthcare, if you want great childcare, you want great education, you have to pay for it.
Okay.
So.
Anything to add, Kim, or ready for the next one?
Nope, that's pretty succinct, and that's the gist of it when you're making the cross-country comparison.
All right, so then I'll pitch this one to you, Kim. We need to point out that claims that the child tax credit is going to lift children out of poverty doesn't hold water, not enough, and temporary at that. Instead, we should point out that the best way to end child poverty is to enable their parents to work, understanding that some parents can't work for various reasons. What are your thoughts on this?
Yes, agreed. Nothing is a silver bullet. Right. And I think that we can't put on the shoulders of any tax credit policy, getting out the workforce. We can't put solving child poverty on the shoulders of that one thing. It really is going to take multiple ways to address child poverty. And if that is the case, what that means is something like the child tax credit is great and probably needs to be sustained, right? To the point of it's temporary. It is temporary in its current iteration. So how do we sustain that? Well, you call your congressperson. You literally call your congressperson, look them up, find out who they are. Things go through the House first and then the Senate. Make sure you're thanking them when they do sign on to something, and make sure they know that you're a voting constituent, right? And this is how we do that. This is how we sustain these things, because this is also how we got this bill out in the first place, is that people heard what their constituents were saying. And that goes for anything, not just tax credits. What do you want to see to help shore up families and to help shore up childcare? Tell your congresspeople, and I know that it sounds very simplistic and basic, but it's real.
Very much so. And the thing is, if you don't say anything or do anything, then people will not, it will not be continued, because they'll say no one really cared. If you care, do something about it.
Great advice. Next question. The pre-K day may not be long enough to cover a parent's workday. Should we try to change this to align pre-K with the workday? What about parents who don't work traditional hours?
Well, very often when you find pre-K in community-based centers, like in Boston, where they have community centers also providing care, what happens is that you do the pre-K day, which might go to 2 o'clock, and then the center kicks in and cares for the child until 6 or whenever time the mom or dad comes to pick up their child. So that's one way that things are done. You have to have wraparound care, because families cannot often get out of work at 2 o'clock to pick up their children. It just does not work. So you need to have care that goes around. You have school age care or community-based care that picks up the other hours that are left to care for children.
Okay, so here's the last question. Earlier, we were speaking about childcare needing to be local. My understanding was hyper-local, but this would also increase inequality because neighborhoods are already segmented by dollars. How can we approach childcare as a local issue, like you said, while accounting for economic inequality? Kim, let's start with you.
I think that's a really astute observation, and something that we, I think, from the local government perspective and the state government perspective, grapple with, I think, immensely. One of the things that is in what is called the Common Start Bill here in Massachusetts, and that's on the table right now, seeking sponsors and co-sponsors, is this idea of, what's the baseline funding that we provide to everybody, right? And so like that helps provide an equitable understanding of how to support different childcare that exists in different neighborhoods and ensure that there's at least a baseline of, we can stay afloat, we can stay open, and thinking about also the cost of living. So like the piece of this as an issue is that in different parts of town, rents are going to be different prices, thinking about how do we support that, thinking about in different parts of town, things may cost different things, and thinking across different cities also, right? Those things fluctuate. And so I think that one way of doing this is really providing that baseline funding for everybody and then tailoring the rest of the funding to making sure that folks are covered in their needs, but also supported in the quality that they're providing.
Thank you. Anything to add, Wendy?
No, that's it.
All right. Well, thank you so much, Kim and Wendy, for answering those questions and joining in today's conversation. I also want to thank everyone in the audience for attending our program this afternoon, and I hope you got something valuable out of it. As I mentioned at the beginning, a recording of this program will be posted on our website within the next week, and we'll email a link to the recording to everyone who registered for the program. Our next social change dialogue will be on April 14th, and it's going to focus on supporting women in the workplace, obviously an issue connected to what we talked about today. Details about that program will be posted on our website shortly. So thank you and goodbye.